Sotyktu is used to treat a certain type of skin condition, moderate to severe plaque psoriasis. Sotyktu contains the active ingredient deucravacitinib. Deucravacitinib belongs to a class of drugs known as kinase inhibitors. It may help to reduce the redness, thickening, and scaling of the skin that occurs with this condition. Indications: Sotyktu is used to treat adults with moderate to severe plaque psoriasis, an inflammatory condition affecting the skin which can cause red, scaly, thick, itchy, painful patches on the skin and can also affect other areas of the body such as scalp, nails, hands and feet. How to use? The usual dose of Sotyktu is 1 6 mg tablet every day. Swallow the tablet well with a full glass of water. Do not crush, cut or chew the tablet. It does not matter if you take this medicine before or after food. Contraindications: you are allergic to deucravacitinib or any of the ingredients. Always check the ingredients to make sure you can use this medicine. Check with your doctor if you currently have an infection that does not go away or that keeps coming back. Sotyktu may lower the ability of your immune system to fight infections and may increase your risk of infections. Have or had hepatitis B or C. Have or had tuberculosis. If you develop any of the symptoms of tuberculosis, a dry cough that doesn't go away, weight loss, fever, night sweats, call a doctor right away. Your doctor may test you for tuberculosis before starting Sotyktu. Have cancer, because a doctor will have to decide if you can still be given Sotyktu. Recently had or plan to have a vaccination. Have problems with your liver. Have any other medical conditions. Take any medicines for any other condition. Precautions: before taking deucravacitinib, tell doctor or pharmacist if you are allergic to it or if you have any other allergies. These products may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Older adults might be at greater risk for infections while using this drug. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. Side effects: common side effects include a cold, sore throat, runny or blocked nose, cough, sores in the mouth, cold sore blisters, acne-like rash and inflammation of hair follicles, serious infections with fever, flu-like symptoms, tiredness, shortness of breath or cough which will not go away may need medical attention.